I'm Scott Pasmore. As we men get older, there are certain things we need to do to make sure everything's still ticking. What and when? We're going to hear from a doctor on men's health. Come on, guys, man up and go to the doctor. Good morning, Arizona.
Speaking of style inspiration, your doctor friend expert for your men's segment is about the most stylish guy in all of Arizona.
Rocking it. He's got a new baby girl.
Right.
He's got it going on. Is your husband afraid to go to the doctor to get, you know, certain things checked out?
He doesn't enjoy it.
Yeah.
Comes back with a little bit of an attitude, but he does go.
You gotta go. Can I just tell you, I think we know what exam we're talking about. The doctor
There's a couple of them.
They pump some air in there to make sure everything's, you know, works out. I don't need to get specific, but the doctor goes, "Let me know when you're uncomfortable," and I go, "You're there."
I'm uncomfortable, and I'm not even at this appointment. I've already heard too much. I don't know about you.
You gotta make a joke about it.
Uncomfortable. Uncomfortable. Yes, doctor, uncomfortable. May I be excused? Yeah, even the doctor's uncomfortable. No, even your story made him uncomfortable. Just when I thought I knew everything there was to know about Scott Pasmore.
Your man will tell you the same story.
Stop him. I don't know. Too much. That's good. There's things I don't need to know.
All right, a new survey finds that men are more likely to make excuses than make appointments when it comes to going to the doctor. Orlando Health surveyed more than 2,000 men, and the top 3 excuses for not going to the doctor: I'm too busy, I'm afraid something's actually wrong, and I just don't like intimate exams like the prostate checks. Well, chances are you get your car tuned up regularly, so what about health? June happens to be Men's Health Month, and all across the country, many groups are spreading the word about that. And to encourage early detection, we have the sharpest dressed doctor in the Valley. Dr. Mark Hong is here with the screenings, things you need to get checked out during certain years, right?
That's right, yeah.
So you want to start early in your 30s?
Well, really, Men's Health Month and just in general, what we're talking about today is being aware of your health. And for men, that's often on the back burner.
Yeah, 20s, we're all good. Start when you're in your 30s, huh?
So what we recommend as physicians is to start thinking about getting regular checkups, and probably in your 30s is a reasonable time to start.
Right. So what are you going to get checked out? Here we go.
Well, you know, in your 30s, you might think about, first of all, establishing care with a primary care physician. That's probably one of the best things to do. And automatically then you will get your blood pressure checked. You'll get examined for, you know, we talk about some of the cancers that actually come up in younger men. Testicular cancer, there's skin cancer. So some of these things you want to get checked for. Of course, there's other blood tests like cholesterol. And as you see, there's testicular self-exam.
Right. All right, let's move into men in their 40s. Here you go.
So this is a bit controversial, you know, especially if you have high-risk factors, then you probably do want to get tested for prostate cancer. So somebody in your family's had prostate cancer, you're African-American. There's a simple blood test you can do called a PSA that is a screening test. And of course, unfortunately, at times, we've got to do a rectal exam.
Is that pretty, just the PSA, is that pretty accurate?
The PSA is not the most accurate of tests. It's just a screening. It's a tool that we use to see whether you might have a problem or not.
So it gets a little more invasive as you get a little older. So to speak.
Yes.
So when you're in your 50s, see, you even laugh about it. So 50s, we have some other things as well.
So yes, in your 50s now, you're actually starting to get into more risk of developing cancer, in addition to other things, heart disease and other things that tend to kill men. By the way, way more often than women, and as you probably know, men have a life expectancy about 5 years less than that of a woman.
Okay.
So these are all reasons why we also then talk about colonoscopy or sigmoidoscopy. That's a camera test in your colon. And of course, continuing to screen for prostate cancer and check for gastrointestinal cancers, that kind of thing.
And certainly, I mean, if prostate cancer, that you definitely want to catch early so you can take care of it.
Well, so prostate cancer is the most common cancer in men behind skin cancer. About 30,000 men die every year of prostate cancer. You want to make sure that you're not one of those guys.
Right, right. What if you're in your 40s or 50s and you just start you know, you feel old. You just don't feel like you used to. You feel down. Is there such a thing as male menopause?
So nowadays we hear a lot about it. And in fact, actually during the finals or whatever else, you almost can't get away from testosterone ads and that kind of thing. But male andropause, what we call it, it's not just about testosterone. It's also about your entire whole wellness. And now, testosterone is one part of it. So as you get older, we may actually screen for testosterone loss, and in some cases supplement testosterone.
Are you okay with that? I know some doctors are like, on the fence about it.
Well, actually, just like anything in medicine, there are risks and benefits, and you want to make sure that you actually go to somebody who's knowledgeable so that you can have that informed discussion. But yes, I've got many patients who have done very well on testosterone.
All right. Dr. Hong, thank you so much. Congratulations on your new baby girl.
Oh, thanks, Scott.
That is, what's her name?
Avery.
Avery. That is beautiful. Congratulations.
Thank you.
All right. Gina?